Good afternoon, everybody. We're going to go ahead and get started. We welcome you to today's press briefing, which is being streamed on the Intermountain Healthcare Facebook page. My name is Jess Gomez from Intermountain Healthcare, and I'm going to be joined today by Dr. Eddie Stenium, an infectious diseases physician here at Intermountain Healthcare, who's been very involved in our frontline COVID care and been very involved during the pandemic regarding the monitoring and treatment of patients for COVID. Dr. Stenium, thank you for joining us. Appreciate your time.
Hey, Jess, good to be with you.
We also are pleased to have journalists joining with us. As always, we ask you, if you have your questions, please enter those into the chat, and we'll ensure that Dr. Stenium is given an opportunity to respond to those questions. We also invite viewers on the Facebook page to submit their questions as well, and we'll ensure that those questions are asked additionally. So Dr. Stenium, we're going to go ahead and get going, and there's a lot to cover today, so we appreciate your time. Let's talk about the Omicron variant. It's in the news, and that's what everybody's paying a lot of attention to. It's getting a lot of awareness in the last couple of days. First of all, let's talk about what it is, this variant, if you can explain. Again, people are hearing about it. What exactly is it? And then let's talk a little bit about what we know about it, because I know there's a lot that's yet to be discovered and to be understood, but let's talk about what it is and what we know about it as of now.
Sure. I think everybody's getting used to the discussion of what a variant is. A variant is a coronavirus, a SARS-CoV-2 virus that has undergone a number of mutations that now is different than our original or ancestral strain that we first dealt with back in early 2020. And so we've had lots of variants. We've had alpha, we've had beta and delta is what we're currently suffering with right now. Omicron is kind of the next variant. And so what is different about Omicron compared to Delta or Alpha or Beta or any other variants that came before it is the sheer number of mutations that we see in the virus itself. And so when we look at the virus and we sequence the genetic code of the virus and we compare it to the original strain that we first saw, or compare it to other previous variants, we are looking at what are the differences in Omicron versus the differences in the previous strains. And what we're seeing is a lot of different mutations in Omicron compared to our original strains. So just an example, Omicron has over 50 mutations in it, and Delta had about 9. And so we see a very significant difference in what it looks like structurally. And that potentially, those mutations potentially could lead to different characteristics of the virus. It could lead to being more contagious or less contagious, or it could lead to having less effect in terms of vaccine-induced immunity, or it could cause more severe disease or less severe disease. And those are all things that we have yet to determine, but we'll be looking at very, very closely. Now, this has come out of South Africa, at least that's where it was identified initially. And in South Africa, it's a very different situation right now. They initially had very low cases, and now they're seeing a significant spike in cases, but they're also very under-vaccinated. And so if you look at the number of people vaccinated in South Africa, you're looking at 24% of the population of actually being fully immunized against SARS-CoV-2, compared to states like Utah that has vaccination rates over 60%. And so it's a very different community, very different epidemiology. And right now we're seeing that Omicron appears to be the dominant viral variant within South Africa. And now we're starting to see it across the globe.
What's the takeaway from people who are hearing about this new variant? We're beginning to live with COVID as we continue through the pandemic, and now there's this new name and new variant. What would you want, particularly those Utahns here, to know about this variant and what we know and understand it to be?
I think the biggest kind of takeaway is that we don't know much about this variant. This variant was identified last Wednesday. This variant is 6 days old, and we know very little in terms of what are going to be the consequences of this variant. And so I think now is the time for us to really dig in, learn about it, try to understand what do these mutations mean, if anything, and see how this is really going to impact us here in the US and in the state of Utah. We have researchers around the globe working on this right now, trying to understand the impact of Omicron, the impact it has on severity of disease, the impact it has on contagiousness and transmissibility, the impact our vaccines will have on it, the impact about monoclonal antibody therapies and whether or not they're going to be active against it, other therapies, how it impacts our diagnostic tests. We are just starting in on trying to understand the details of Omicron. And we're going to know much, much more in the next 10 days to 2 weeks to really understand, is this going to be a big deal for us? And the other part is that we shouldn't lose sight of what's happening to us right now in Utah. Right now in Utah, Omicron is not affecting us. Delta is affecting us. This is where, our situation is right now and where we need to be focused on in terms of our hospitalizations. 20 new deaths released today. Our focus needs to be on Delta right now, and we're going to be learning about Omicron and its potential impact and how that potentially could change, any types of policies we have. But right now, our focus needs to be on Delta.
Yeah, as we hear news about the spread of Omicron, and apparently this afternoon it's being identified in other continents. We've heard that it's been identified in Canada, so which means it's only a matter of time, if not already in the U.S. It just hasn't been identified. So it's going to be here in our country. For people who have been vaccinated, what's your message? I've heard questions: Am I protected? And then conversely, also, what's your message for those who have not been vaccinated for both Delta and Omicron?
Yeah, so the messages are pretty clear and consistent with what we've been saying. There are some hints coming out of South Africa to suggest that prior infection with either, in South Africa, Beta or Delta variants in South Africa does not offer significant protection against an infection with Omicron. We also just don't have the data to be able to say anything about how well our vaccines will prevent infection against Omicron. Will they prevent infection or will they prevent severe disease? Both, neither, we just don't know. Way too early for us to be able to make any decisions on that. But what we can say is that if you haven't been vaccinated, get vaccinated. If you've had previous infection and you haven't been vaccinated, the time to get vaccinated is now. And if you've been vaccinated, ensure that you get your booster dose when appropriate, and do that soon in preparation for a potential new variant within the US. Vaccination is our way to prevent new variants. And so the reason that we're going to see new variants is because we're going to have large scale transmission somewhere in the globe. If we're having large scale transmission, we're going to see variants develop. And so vaccination is our way to prevent the ongoing development of variants. And so the message continues to be clear. We need to get our population vaccinated. Those that haven't been infected need to get vaccinated. Those that have been previously infected need to get vaccinated. And then we need to get boosters when people are eligible.
We'll take some questions from the media here in just a moment, but I want to get back to something you said at the beginning of the pandemic. And you said, as I paraphrase, that the job of a virus is essentially to survive. And in order to do that, to adapt to its current always changing environment, it's going to mutate. So having said that, does it surprise you of this news that we have this new variant that appears to be spreading fairly rapidly at this point?
No, we knew that there was going to be new variants. That absolutely was something that we expected, and they were going to come. If you are having viral transmission, you are going to have the development of variants. That's what viruses do, and that's what we expected. And so the fact that we have a new variant right now is not surprising. What is the challenge right now is the sheer number of mutations that it has, and whether or not that's going to have a very significant impact on all of those things we've already mentioned.
Okay, we want to talk a little bit about kind of our current situation here in Utah with Delta that we're dealing with, and I'm going to take some questions from the media, and again, encourage any other questions, please enter those into the chat. We'll begin with Sean Means from the Tribune, and again, Dr. Stadium, if we can answer these, great. If not, we totally understand, but again, I'm going to ask those questions that reporters joining us are asking. Sean asks, based on what we know so far, is Omicron more transmissible than Delta variant or less? And then also, is Omicron causing milder or more severe symptoms than Delta? Again, I don't know if you
Yeah.
can answer that, but what would you respond?
Really, really early data out of South Africa looks at, the epi curves of Omicron and comparing it to Delta and also to Beta. Based on those curves, it looks like it may be more transmissible. How much is unclear, and how much of an impact vaccination in our communities has on that is also unclear. It looks like hospitalization data seems to be tracking very similarly to Delta in the previous surge in South Africa. So right now, again, really, really early data. I'm hesitant to make any kind of claims about transmissibility, but the early data out of South Africa looks like it may be more transmissible than Delta, which was significantly more transmissible than our original variants, our original virus that we dealt with. In terms of severity, we have no idea. And so can't even speculate on that in terms of is it going to cause more severe disease or less severe disease. We'll definitely know more in the next coming weeks as South Africa undergoes the surge and they continue to do their genomic surveillance. But as of right now, unable to say.
Yeah, with that in mind, and as we, continue our life here in Utah, go to the supermarket, go to the store, I will share my thoughts. I see very, very inconsistent use of masks, depending on where you're shopping, where you're at. What's the current recommendation in light of Omicron in terms of masking and some of those public health measures that we've talked about in the past in terms of distancing? Given that we are seeing high rates of Delta and then also possibility of this new introduction of Omicron, what's your recommendation regarding some of those standard recommendations that we had? Do we still have those? Are you still recommending that we put on masks while we're out? What are your recommendations?
Yeah, in indoor places where social distancing is not possible, where you're going to be coming into contact with people that you don't know their vaccination status, absolutely wear a mask. We are still in the middle of a global pandemic. We are at 102% capacity in our ICUs. We need to do everything we can to reduce the spread of COVID-19 in our communities. And that includes, when you're indoor settings, is to wear a mask. So yes, absolutely, grocery stores, places where you're coming into contact with people, I would recommend wearing a mask.
Okay, back to these questions. A follow-up question from Sean. If Omicron turns out to be a dud, is there a concern that the public perception will be that scientists were crying wolf? And I don't know that that's the case, that anybody's crying wolf, but it's obviously got a lot of attention. What's your response to that?
It's a really interesting question, Sean. I hadn't thought of that. I think scientists have the duty to be transparent in what we're seeing. And right now, that is what the folks in South Africa are doing. That's what folks across the world are doing, and saying, hey, we've identified this new variant. It's a variant of concern where it could impact clinical care and our communities. And so I would say, it's scientists being transparent with what we are seeing right now across the globe. And we're going to continue to be transparent because the public's demanded that of us. And I think that, we owe them that. And so, if you want to call us crying wolf, that's fine. But we're
Alana Sheriff.
Going to continue to be transparent.
Thanks. I had a little skip there. Question from Alana Sheriff at Fox 13 News. Are breakthrough cases on the rise, and why is the booster so important for Utahns right now? And Dr. Stadium, it might be good for Pat to bring up the graphic of our current composition of patients in the hospital, Intermountain Healthcare hospitals. And if you can see that, we'll share that. We'll attach that out as the copy of the recording goes out after this briefing. But here's the current composition of patients with COVID in Intermountain hospitals. And perhaps it goes to Alana's question. Eddie, do you want to talk about the numbers here?
Yeah, I'd be happy to. What we're looking at here are patients admitted to the hospital with COVID-19 that have symptoms of COVID-19 that are admitted to any of our units in the hospital that cares for those patients. And of those people with COVID-19, we look at their vaccination status. And what we're seeing right now is really consistent data that's been consistent over the past approximately 3 months now, showing that the majority of patients that we're seeing in the hospital are unvaccinated or not fully vaccinated. So 85% of the people that are being admitted to the hospital with COVID-19 are not fully vaccinated, and 15% of them are fully vaccinated. And of that grouping of that 85%, the vast majority of them are just not vaccinated, haven't initiated any kind of vaccine series. And it continues to be seen that when we compare the people that are in the hospital with COVID-19, those that have been vaccinated versus those that have been not vaccinated, the folks that have been vaccinated with breakthrough infections are significantly older than those that are unvaccinated and have significantly more medical comorbidities than those that have been unvaccinated. So it shows to us that the people that are having breakthrough infections that are leading to hospitalizations are older and have more comorbidities. These are people that fail vaccines in general. They fail the pneumococcal vaccine. They fail the influenza vaccine. These are people that haven't been able to generate an immune response to appropriately protect them from COVID-19 and severe disease. And what has really been interesting is that the proportions that we're seeing in the hospital have stayed very consistent over the past 3 months. Now, when we look at national data in terms of vaccine effectiveness, in terms of preventing hospitalizations, preventing ED visits and urgent care visits, we do see waning of the vaccine, especially when you get out to 6 months. Getting a booster shot brings you back up to that high level of protection that we originally saw in those clinical trials. And so a booster is incredibly important. That being said, our main message still remains is that we need to focus on getting people vaccinated that haven't initiated the series, because they're the ones that are predominantly in the hospital. And those that have and are now at least 6 months out from their vaccine, their initial vaccine series needs to get boosted to get that added protection.
Okay, and to answer Sean's follow-up question, yes, these are the current patients as of today. This is brand new data as of today. So this represents the current hospital population within the Intermountain hospitals across the state and across our system. So, okay, we'll jump to one follow-up question from Alana Sheriff, and then we'll get to Jamie and Lisa. Alana has a follow-up question. What would you tell people who are vaccine COVID skeptics and remain skeptical? She says there seems to be a lot on social media who are not convinced this is real. What do you say at this point? At this point in the pandemic?
I mean, this is very real. We had 20 people die reported yesterday from COVID-19. Our hospitals are full with ICU patients with COVID-19. We haven't been, under that 85% utilization threshold since mid-August. And so this is very, very real. It continues to be very real. And I hope people are getting their information from reputable sources and really understanding the true nature of this. We are definitely not out of the woods from a pandemic standpoint, unfortunately. And we're going to continue to see this as long as we're having susceptible populations in the state of Utah.
Jamie Lampros from the Standard Examiner asked, there are a lot of people who think these vaccines may change your DNA and may end up killing off populations. How do we convince people that this is not the case?
Clear, transparent data. This vaccine, these vaccines, Pfizer, Moderna, J&J, AstraZeneca, the list goes on. These are the most studied vaccines in history, period. There hasn't been a vaccine that's been more intensely scrutinized, more intensely studied from an effectiveness standpoint and a safety standpoint than these vaccines. These vaccines are literally under a microscope every single day. And so we are confident in terms of the safety profile of these vaccines and also how they prevent disease. And so the science is clear on this. It's not subtle. These are safe vaccines and they're saving human lives.
Question from Lisa Riley Roche of the Desert News. There is talk that the vaccines may need to be reformulated to be effective against Omicron. Should Utahns wait to see if that happens or go ahead and get a booster immediately?
Yeah. So what happens with the Omicron mutation is that it changes the conformational protein structure of the spike protein. And the spike protein is what we generate an immune response to. And so Omicron has all these mutations in the spike protein, so it may look conformationally different, which is going to change the immune response that we generate to it or the protection that we've gotten from our previous vaccination. And so right now, Moderna and Pfizer are also looking at what it would take to develop an Omicron specific vaccine. And fortunately, the mRNA platform allows us to go in and change the structure of the RNA that's used to develop these vaccines and change it quite quickly. And so Moderna and Pfizer say that they're about 100 days out to potentially developing and marketing an Omicron specific vaccine. There's a lot of ifs there. And right now we are being challenged by Delta. And so what I'd recommend people is get a booster now, and let's see how this plays out with Omicron in terms of a spread to the US and what the impact is across our communities.
Talk a little bit about what we're seeing inside the hospitals. We thought we saw the composition of patients in terms of volume. You just mentioned that, again, Intermountain hospitals are over 100%. What's that continuing to feel like? We've talked about that over the last almost nearly 2 years now, but I'm going to ask that same question. What's it feeling like, just to give everybody a current refresh of the environment that people may not see behind closed doors?
Yeah, it's hard to put that into words, Jess. We've been so in the thick of this now for so long that, people have kind of evolved in terms of their emotions. We're at, as of today, as of just prior to this filming, we are at 102% capacity in our ICU COVID hubs. We're at 100% capacity in our just general ICUs across the organization. And we've been at that level now for months. We've also, dialed back on non-emergent surgeries. And so people are not getting the care, the surgeries that, may not be emergent, but certainly are really, really important to them. And so it's just a different feeling in the hospital. And I can tell you right now, we're still at 102% capacity, and we haven't felt the impact of the Thanksgiving Day holiday. And so there's a feeling of dread of what's to come when we're this busy, and we're now just coming off of a really significant holiday where people get together and they gather with friends and families. They fly over across the country, which could certainly increase transmission and increase hospitalization. And so we're obviously making preparations of what we would do if we need to accommodate more patients. And it's equally as busy now than it has been. And so we hope that we have some relief coming in the next couple months as hopefully cases come down and Omicron does not, rear its ugly head here in the US to give our caregivers a little break.
What's the anticipated lag time that we can expect to see or not see, hopefully, that impact of the Thanksgiving holiday? We know, you and I were talking before we started here, the numbers that came out today show 1,195 new cases. We also show that testing is significantly way down. So that's a little bit of a inaccurate marker. We probably think there's far more new cases than that. Just testing has been down. But what's the lag times that hospitals may feel this impact from the Thanksgiving holiday?
Yeah, so incubation time for this virus is between 7 and 10 days. And we've looked at this on previous holidays that we've had here in the state of Utah. We start seeing an increase in cases post the holiday, starting around day 5, post holiday, going out to really kind of day 10 and 12. And so we'll likely start seeing the impact of the holiday towards the end of this week, as long as testing is sufficient to really understand the true nature of transmission. And then shortly thereafter, we see the impact on hospitalizations. And so that's really kind of what we're looking at. The next 2 weeks will be pretty telling in terms of the transmission that occurred at Thanksgiving. We hope people were smart in terms of how they gathered and ensured people were vaccinated. And we'll see the true impact of transmission here shortly.
Okay. Daniel Woodruff from KUTV2 News has a follow-up question. Do you expect ICU beds will remain at or above 100% capacity for the foreseeable future? Or is there a projection as to when they may fall? I don't think there's a projection, but what are we seeing in terms of what we're hearing from the CDC and kind of what we're seeing with modeling?
Yeah, it's really interesting and a nuanced question. I mean, if you look at what happened in Idaho and Nevada, regional neighbors of ours, they had a very significant and elevated Delta spike, and then it then it essentially went away. And if you look at, Idaho numbers, their hospitalizations have completely fallen off, as in addition to their cases. That hasn't happened in the state of Utah. We've had this Delta spike, and now we've in this high plateau, and we haven't had a decrease in cases yet. And so the differences there is unclear in terms of why Idaho and Nevada is acting differently than Utah and Colorado. And we're seeing this in other states as well, where some states will have a high, quick peak and then a quick drop off. Why that's not happening in Utah is unclear. I do think we were starting to see a decrease in cases prior to the Thanksgiving Day holiday. And so that may signify that we're, trending downward, and we may see a blip from Thanksgiving and then a continued downward trend. I hope that's what we see. And so our modeling does project us not factoring in Omicron or any impact of a new variant, that we would have decreasing cases through November and December. And we're starting to see that decrease at the very end of November. So I'm hoping that those modeling estimates holds true, and then we start seeing a decrease after we see a bump in Thanksgiving through the month of December.
A question for one of our Facebook viewers asking, they've had experience with a family member who developed blood clots related to COVID, the Delta variant. Are blood clots related to the COVID Delta common?
Yeah, blood clots are certainly common in people that have active COVID-19. It's an area of study in terms of how to prevent them. But blood clots are certainly a common complication of COVID-19 infection.
Okay, well, we're nearing our time here, Dr. Stadium. I give you always the opportunity. What's your message? We're talking a lot of new things that we don't quite have a full grasp yet on, but what would you leave us with in terms of the community, what they should know about what's happening and how they can help our hospitals and healthcare workers?
Yeah, I think that one thing is, Omicron is potentially scary, a lot of mutations that we just don't know much about. I would say, focus on what's in front of us right now. Focus on how do we prevent transmission currently here in the state of Utah? What do we need to do to confront the challenges that we have in front of us? And right now that's vaccination. It's continuing to, of those people that have been vaccinated, get boosted. Those that haven't been vaccinated, it's time to get vaccinated. That's what we can do right now to ensure that as we go through this holiday season, we can do it in a safer, more effective manner. And so we will continue to, watch and monitor and really dive deep into Omicron and what's going to happen. And we'll continue to update the public on it. But I would say for the vast majority of people in the public, we should really be focused on what we can control right now in front of us. And that is vaccination and controlling spread by good public health measures, wearing masks and limiting contact with people that are high risk and susceptible to this infection. We really hope that we start seeing a downward trend to give our caregivers a holiday break and relieve some of the pressure in the ICU. And we can start getting back to, the care that we know we can provide and are really good at providing in terms of surgeries, and continuing to get back to that standard of care. So I would leave the public with that.
Well, thanks again for joining us. We really appreciate it. Thank you for all that you're doing. We appreciate those who joined us on Facebook, and to all the journalists who are with us. We will follow up with a link to download today's press briefing, along with the graphic that we shared with you that is representing the current data of hospitalizations within Intermountain as of today. With that, again, thanks, Eddie. We appreciate your time. Best of luck to you. And thanks to everybody for joining us. Please have a good day.
Thanks, Jess.